Hello, I am Dr. Lawrence Smith, Dean of the Donald and Barbara Zucker School of Medicine at Hofstra Northwell. Thank you for tuning in to Well Said. In a culture of community, scholarship, and innovation, the Zucker School of Medicine is dedicated to transforming students into doctors who will improve healthcare, inspire change, and better the lives of the people they serve. It is why we are pleased to collaborate with WRHU Radio Hofstra University to bring you a program committed to sharing expert discussion and insight on health and wellness topics important to you. Join us today and each week for a recommended dose of Well Said with your host, Dr. Ira Nash.
Hello, I'm Dr. Ira Nash. Welcome to Well Said. As part of our extra series on COVID-19, we've previously talked about COVID variants, COVID vaccines, and the long-term effects of COVID-19. Today, we'll be getting a COVID update and discussing the issues surrounding going back to school this fall. My guest is my colleague, Dr. Marcia Epstein. Dr. Epstein is the Associate Chief of Infectious Diseases at Northwell Health and a Professor of Medicine at the Zucker School of Medicine. Marcia, welcome to Well Said.
Thank you very much for having me, Ira.
So first, let me ask you how you've been managing as an infectious disease doctor in the middle of a pandemic.
Like everyone else, we've had our ups and downs. When it first started, we felt gratified that we could do something and help the community and be there, and we worked as a team, and we were all enthusiastic. And this summer, when things slowed down, we were so happy. We thought maybe there was light at the end of the tunnel, and it's very painful, as it is for everyone, to go back and see the number of cases go up as a variant increases and seeing the number of hospitalizations go up. So it's been a bit overwhelming, and I think watching the spirit in the hospital, I looked up, knowing that I was going to be here, I looked up, there were over 3,607 healthcare workers who've died over the past year and a half because of this.
Oh, my God.
Yeah. In fact, our former chief of medicine, Dr. Kamholtz, died from COVID, so it really hit it home. So I think a lot of people's spirits are dropping. People are trying to juggle families and work and our responsibilities. And personally, I don't really have time off. Even when we're off, we're getting calls around the clock, and understandably, we're happy to help anyone we can, but it's been overwhelming, but we're not alone in feeling that.
I'm glad you were honest in your reply. I mean, this has been sort of an ongoing national trauma. I think what you say captures what a lot of people are feeling. It's just kind of exhausting that it's gone on this far, and we are where we are.
There's actually been a national shortage of nursing. A lot of nurses have chosen to retire early or go to doctor's offices. They're burned out because of this problem of nursing. Not here, but in some parts of the country, they've actually had to close ICU beds because they don't have the nurses to staff it. So it not only affects the COVID patients, it affects patients with other issues. So that's been an additional stress.
Could you give us a little bit of kind of a thumbnail sketch of what's happening with COVID around the country right now?
Everyone thought, oh, this is great. The beginning, May or so, the CDC says you could take off your mask if you've been vaccinated, and people started congregating. The weddings started happening. People were gathering carefully, but we were all excited. With the Delta variant revving up, things quickly got bad again. Last week, I think there were over 90,000 patients hospitalized with coronavirus, and now we're averaging around 1,000 deaths a day.
Those are national numbers, you're saying?
Those are national, right? Certainly not. Yeah, certainly not Northwell.
Yeah.
And the South is really having its most serious outbreaks, and there's been record numbers in Florida, Mississippi, and Louisiana, and hospitals just basically struggling to keep up. So we're back in a crisis mode.
Yeah. So, one way to look at the pandemic that I've found helpful is to consider that these ups and downs, the increases and decreases in cases, seem to me to depend on three different things and how they interact with each other. One is how many people in the community are vaccinated. Number two is how contagious the circulating strain of the virus is. And the third is how people behave. That is, to what extent they observe recommendations about avoiding crowds, wearing masks, and so on. So I guess I have two questions about that. First, do you agree that that's a kind of helpful shorthand for looking at things? And if you do, which of those three factors do you think are most responsible for what's going on right now?
So we talked about, one, how many people are vaccinated. So we certainly see that if you're vaccinated, you're not going to get very sick, and even if you have to be hospitalized, you're not going to die. So my personal experience is those in the hospital are basically people who are not vaccinated or people who are immune compromised in some ways or the elderly. We're not seeing healthy young people vaccinated as a rule being hospitalized. So that's the first thing. The second thing is about the virus. So when we talk about the virus, there's something that scientists call R0. And the R0 is if you had a world where nobody was vaccinated, there's no immunity, and you got exposed to this virus, how many people would get sick? So just to give you a rough idea, like the R0 for flu, I think it's like 1.5. The R0 for the original coronavirus was maybe a little bit higher, closer to maybe 2, but that was a number. Now with the Delta strain, the R0 is around 6. So that means that for every individual who has the virus, 6 people will get infected, and then 6 more people will get infected. So it's growing exponentially at a more rapid rate. And then the third part to your question is, what about the additional factors? So the vaccine, even the best of vaccines, are not 100% effective. So there's layers of things that people could do. There's social distancing, there's hygiene, there's testing if you feel sick, and mask wearing. And these are all important. They all contribute. So which is most responsible? They're all important. Probably the fact that we have such a highly contagious virus is probably the biggest factor. Now, there was some leak from last week where somebody said, the CDC said that it's as contagious, as measles, but it's not quite as contagious as that, but it's still very high risk, and I think that's probably the biggest factor.
But I do want to underscore something you said a minute ago, which is that even with more highly contagious nature of the current Delta variant, the vaccines are still effective at certainly preventing death and largely preventing hospitalization as well. Is that correct?
Oh, yeah, absolutely. And I correct myself. They said it was as contagious as chickenpox, which has an R0 of 10. But yes, that's absolutely the case, that if you vaccinate, you're not going to likely get very sick, and even if you're sick enough to be hospitalized, you're not going to likely die. So and that's what we're seeing across the country, that most of the hospitalizations are people who are not vaccinated or didn't respond appropriately to the vaccine.
Right. So again, just to underscore the obvious, that another way of saying that is that these vaccines are lifesavers.
They're highly effective.
Yeah. So I want to concentrate our conversation on the issues that parents, educators, and kids are facing with regard to going back to school. I mean, obviously, in light of what you just said about vaccines, this would be a lot less challenging if children could be vaccinated and protected as they are against other viral illnesses like chickenpox and measles and others. So as of now, the FDA has made the vaccines available. Could you tell us a little bit about why the vaccines have not been approved for younger children?
Before you study children, usually when you study a new vaccine, you study adults first. You study healthy adults. You want to sort of learn about the vaccine, learn about the safety, and then once you have that data and you feel confident, you could go on to the next level. Then you could do trials in pregnant women. You could do trials in children. Now, you got to remember, children are not just little adults. Children behave differently. In fact, their response to COVID is different. And in order to test children, remember, we also have to get permission from parents. And a lot of parents are hesitant, so you have to get the numbers. And because the children, when you get an EUA, you basically look at a number of trials patients, volunteers, who for like 2-month period. You may want to follow a little longer. There's some controversy. Should you follow 6 months for children? Because you just want to make sure that if there's some rare side effect that doesn't present itself. And then of course you're always looking also at the manufacturing process. We usually, there are people who say that once you have a vaccine out for 6 weeks, you'll know all the rare side effects. So people are arguing if we wait the 6 months, there's so many more children are going to be infected, and it's going to be so much worse. So they're moving along pretty nicely, and we think that we'll have some more information that by the end of the year, the beginning of next year, we'll be able to have an EUA for younger children, but we're not there yet.
Yeah, and that's still quite a ways off if we're talking about making decisions about going back to school in late August, early September.
Right. So, I mean, there are other things we can do, and there's a lot of controversy about some of them, but the things that we talked about before. So every adult who is exposed to their children can be vaccinated. And now I think that we have FDA approval of the Pfizer vaccine. That's going to be easier to mandate. So that's one way the children can get it. So every adult and families of these children should be vaccinated, and this would be huge in helping to stop the spread. Then measures like social distancing, mask wearing. By wearing a mask, anyone who may be shedding virus won't be able to spread it as efficiently. Hand hygiene, cleaning of the rooms, testing. So if anyone, there's different theories of how we can test, but testing, especially if someone is sick, keeping the child home so that they don't go to school and potentially spread the virus to other children. What you can also do is vaccinate for flu, because we're not going to know who has flu and who has coronavirus necessarily, and then children may be kept home unnecessarily. So there's lots of measures that we can do to sort of help prevent the spread of the virus in school.
Do you think that the greatest risk to children in school is from other kids, or is it from the adults who may be unvaccinated that they come in contact with?
Well, that's an interesting question, because the data is not all there. I think that I would think that it's hands down the adults who aren't vaccinated. There was some theory that children were less contagious than adults, and last year when the schools opened, there wasn't a major problem of children spreading the virus. But there was just a recent study in JAMA Pediatrics where they looked at households, and they found that the older children were likely to bring home the virus, but within households, younger children were more likely to spread it, but they felt that was more because they needed to be, these are young children, so that they needed to be cared for by adults. They're in close contact, and they couldn't be isolated. Mm-hmm. But, we don't know. I mean, with the Delta virus, the number of viral particles is so much larger. We don't have that information, to be honest.
Yeah, I think that's probably an important fact to underscore, that I know people are anxious and want answers, but the truth is there are still a lot of questions that we just don't have enough data to answer, right?
Oh, yeah. I mean, we always believe in the science. So what we could do, though, is protect us on every level. You protect the children from other children by wearing masks, and you protect them by the adults by having the adults vaccinated and having them wear masks. So right away, those are two things we can do to help prevent the spread in this crazy world. The number of pediatric. So last year we were like, oh, kids don't get that sick. It's every parent sort of had a sigh of relief. But the number of pediatric hospitalizations has gone up 22%. And now, again, as I mentioned before, kids aren't exactly like adults. So usually the good thing is they're not that sick, but the number of hospitalizations have gone up. And then there's this other syndrome called MIS-C, which is multi-system inflammatory syndrome. It's in children, and it's sort of like a Kawasaki syndrome, and it's rare, but we've been seeing that. I don't know why the number of children's hospitalizations have gone up, but again, I'm wondering if it has to do with the strain, that the amount of virus being transmitted is larger. But again, no one knows why.
Yeah, and just to clarify a little bit on that inflammatory syndrome you mentioned, that occurs not necessarily with the acute infection, but sometime later. Is that correct?
That is correct. So it's usually the kid gets COVID, doing a little better, then 3 or 4 weeks later they present with some of the symptoms of that something's wrong: fever, shortness of breath. There's a host of symptoms that they may present with.
And even though you said that that's thankfully rare, it can be a very serious consequence, right?
It could be a life-threatening condition. These children sometimes end up in ICUs. It's something we're very concerned about, yes.
So let's go back to kids in school. And you mentioned a couple of things that schools can do to protect children, but I want to kind of go through them maybe a little bit more systematically. So the first you mentioned is vaccinate all the adults. That's kind of a no-brainer to start with, right?
And not just the teachers, but the custodial staff, the people working in offices, the crossing guards, anyone who may have contact with the students. So everyone and anyone who could potentially be vaccinated, if we could vaccinate them, it would make a huge difference. And
then
family
you mentioned
members, and families,
yes,
and
family
their
members,
own
sure.
families, yeah.
Right. So kind of create an environment where all the adults that kids come in contact with are vaccinated.
That's correct.
Okay, that's number one. Let's talk a little bit about the masking of kids and people they come in contact with. How young, or I guess how old does somebody need to be before they should be masked? I mean, obviously we're not talking about a toddler here.
Right.
But are you saying anybody of school age, 6 and above, 5 and above, should be wearing a mask?
That's the guidance that I've read. But it's hard. We all hide in our office and take a mask. When you have private time, it's a long day. How do you go about it? They could do things like while the weather's good, have more outdoor activities. Certainly keep the ventilation good, but it's a very hard thing to ask of these children. But for now, that's the best guidance we can offer until it's safer out there, until they're vaccinated or the rate of viruses goes down.
And you would recommend that for all of the people in the classroom, the adults in the classroom as well?
Oh, absolutely,
okay.
Yeah.
Regardless of their vaccination status?
Right, because you can get COVID if you've been vaccinated. You could be asymptomatic and not even know that you have it, or you could think it's just a cold and just have mild symptoms. So you may not know that you're shedding the virus. So that's why that's our current recommendations.
And you mentioned ventilation. So let's talk about the indoor-outdoor question. From what I've read, it seems that being outdoors is really way safer than being indoors. Do you agree?
Oh, dramatically. There's been all sorts of studies looking into this. They say the level of outdoor transmission is something like less than 1%. So that's a wonderful way for the kids to just to be together and not have to wear the mask. And I would encourage any outdoor activities that we could have. I think the one exception may be some close contact sports, but in general, being outdoors is a terrific way for the kids to be able to take off their masks and not feel so confined. And certainly, if there's any activity that can be done outdoors, would be fantastic. But even in the classroom, keeping a window open, having HEPA filters, there's other things that one could do to improve ventilation to lessen the chance of transmission of virus.
So it sounds like out on the playground, school-age kids, okay to take the mask off. Let's talk about the ventilation and airflow in the classroom a little bit. There was a recent report that all of these plastic or plexiglass barriers that people have put up to kind of separate people from one another may be doing more harm than good. What's your take on that?
It depends of the whole configuration. You don't want someone coughing in your face, and I think that's the purpose that they serve. I think we use HEPA filters. In fact, in the hospital, we have HEPA filters in some of the rooms that aren't negative pressure rooms, and that's something that could easily be put in the classroom. Keeping windows open so there's cross ventilation. I think those are things that could be very effective. I think what the plexiglass may do is help sort of remind people to be separate. But if the air is, I guess, I'm not sure the studies you're referring to, but if the air is sort of stagnant around, if something's enclosed, no, that wouldn't be helpful.
We're struggling as a society to get more and more people more and more adults who are eligible to get vaccinated to roll up their sleeves and get their shots. What's your opinion about vaccine mandates for, say, educators in the classroom, or for that matter, healthcare workers?
I think we have to respect people's hesitancy to get the vaccine, and I think we need to sort of make them feel comfortable that we're not forcing on them, but that it's a safe vaccine. There have been over 4.95 billion doses of vaccine worldwide, internationally, and in the United States, there have been 363 million doses. So it's been given. What's going to happen is going to happen. We've already, there's been a huge number of people receiving the vaccine, and no vaccine is 100% safe. Anything can happen, but it's one of the, it's a very safe vaccine, and it's a very effective vaccine. And I think we have to listen to people's hesitancy. We have to discuss with them and not attack them and talk to them about it. I think now that the FDA today approved the vaccine, I think we're going to have more people willing to do it. I think we shouldn't attack people, but we should have, thoughtful discussions with people to encourage them. I think people have choices. If they're not comfortable working, if they don't want to get the vaccine, then they have to understand they may not be able to work in the health system. We're not forcing them. They may have to pick another career. But if a healthcare worker transmits the virus to a patient who's vulnerable and the patient dies, that would be a horrible thing. So they have to understand that maybe then this isn't the career path for them. But I think it's important that we're patient with people and understand the hesitation. And it's scary. I think before we got vaccinated, we were scared, but assuming you were too. But
Yes.
but there's now a lot of safety data out there. It looks very good, but nothing is 100%. And I understand hesitation, but overall, it's a very safe vaccine, and it's a very effective vaccine, and that's something we should stress. And it's going to keep you alive.
So let me just press you on that a little bit, because I was way more scared of getting COVID than I was of getting the vaccine, and I was.
That's the bottom line. Yes.
Right. So I was more than happy and looking forward to the opportunity to get what I thought at the time was a safe and potentially life-saving vaccine, and I think as we've been saying, hundreds of millions of doses later, that seems to be the case. So I guess, as much as I agree with you that it's important to educate people, talk to people, understand where people are coming from, if we take this back to the school setting, do you think that unvaccinated people should be allowed to stand in front of a classroom of kids?
I do not. But it's not us forcing them to get it. They could choose another career path, though, then, because I don't think it's fair to our children, especially now when the children don't have the option of getting vaccinated. And there's always going to be some immune-compromised child who may not be able to receive the vaccine, or it may not work on them. So I think it would be unfair. So I'm happy for the FDA approval, and I think that we have to mandate these things. I think for myself, watching these patients with COVID and watching them struggle to breathe, and I saw young people thrombose the coronary arteries. We actually saw a 50-year-old woman lose her arm from a thrombosis. People having pulmonary emboli, young people having strokes. You don't forget that, and you're desperate to get this vaccine and not have those sequelae. Now, there are people who weren't that sick. They called me every day. We went over everything. They weren't that sick, and now they have long COVID. I know a physician who had to quit her job, a very capable, bright physician, quit her job because she can't multitask. She can't think through problems. She has that quote-unquote brain fog, the long COVID. So these are people who weren't that sick. They're children who are having problems thinking clearly now. There's fatigue. There's pulmonary damage, lifelong pulmonary damage. There's all sorts of sequelae from COVID that are so much worse than anything from the vaccine. So, so any vaccine is scary. Any vaccine could have some side effects. They're very rare, but they do exist. But it's not rare to have a consequence from COVID. And we always talk to medicine about risk-benefit ratio. So I think the decision becomes easy.
Getting back again to the school situation, is there any particular advice you would give parents about sending their kids back to school this year? What questions should they be asking? What should they be demanding of schools?
I think the kids have to go back. I think that both academically they're lagging behind because of all this homeschooling, and I think socially and psychologically it's important. So I think they could demand that the school makes the safest environment for their children, and whatever it takes for their child to be safe. They shouldn't be afraid that they're sending the kids to school to be vulnerable, to get a life-threatening illness. And I think that the school owes them that they take good, careful care of their children and provide a safe environment. And so the things we talked about, and that's why that the staff is vaccinated, that masks are worn, that outdoors when possible, appropriate ventilation, respiratory etiquette, stay home when you're sick, testing policies, whatever it takes to make sure those children are safe.
So let me have us take a step back from what's happening right now. And I want to spend the last few minutes that we have trying to look to the future. We've been dealing with this virus, we collectively, the whole country, the whole world, for over a year and a half. And as you pointed out, everybody I know is getting tired, getting frustrated. Some are getting angry. How much longer are we going to be dealing with this? And how do you think this ends? Look to the future and describe what you see.
I think if people are not vaccinated, this is just going to perpetuate because the virus then has an opportunity to mutate and keep on outsmarting us and outsmarting our immune system. And if we don't do something, even with the vaccination rates we have now, it would take 6 months for the world to sort of, and remember, we're not just isolated in the United States, we're a part of a world.
Yes, of course.
So you can't.
Right.
So it would take 6 months to just get to 75% of the world being vaccinated. So it's not going anywhere soon. Our best hope, I don't think it's going away. I think our best hope is that it becomes like a cold or a nuisance, but it isn't a life-threatening infection. That we can get some control of the situation, and it's like other respiratory viruses where most people just get sick or inconvenienced, but majority of people, it's not life-threatening. And I think that's the best optic that I see. I hope I'm wrong. I hope it can just go away, but I don't realistically see it going away.
And to get to that stage that you just talked about, is that something that you see happening this winter, next year? Can you put a timeline on that?
I don't know. I think, though, it's not going to happen, I could tell you, if people don't get vaccinated, if we don't practice some smart choices. I think that's just giving the virus an opportunity to just keep on going. But I'm hoping, we're all hoping sooner than later, but I don't think it's going to be in the next few months. But look, we had some time periods when it got a little better, and if we could even get back to May or June, that wouldn't be so bad.
No, I think we all look back at that now as sort of like a
honeymoon period.
Magic interlude between between the horrible peaks. Marcia, thank you so much for sharing all your insights with us today.
Thank you. It's a pleasure to be with you.
My guest has been Dr. Marcia Epstein. Dr. Epstein is the Associate Chief of Infectious Diseases at Northwell Health and a Professor of Medicine at the Zucker School of Medicine. For more information about this program and to find past episodes, please visit sites.hofstra.edu/wellsaid. You can also subscribe to our free podcast available on Apple Podcasts, Stitcher, or wherever you get your podcasts. Our listeners are welcome to send comments, suggestions, and questions to wellsaid@hofstra.edu. Until next time, I'm Dr. Ira Nash, and that's Well Said.